Gurmagad Cairn Minister, we're in a pandemic situation. We have a virus that is making people unwell and is killing people. And I wish that other aspects of Irish society and Irish public policy were dealt with in the same manner which government has dealt with this issue and these other issues such as Brexit. There is nothing that government would not do or would not say or would not intervene or would not find the resources in order to deal with the issue of Brexit or indeed this pandemic. There is another scourge in this country which kills people, which ruins families, which makes people incredibly ill, which shortens their lifespan, which ends their lives in public toilets, in stairwells, in parks and playgrounds. We have the third highest overdose rate in Europe, and yet we don't have the same political response to it because, in effect, the value on those lives is less. And I know that to be the case because the very people who suffer from addiction and are in recovery trying to rebuild their lives are called names. They're called names by politicians, they're called names by media. They're called junkies, they're called druggies, they're called zombies. I heard one commentator on RT Radio once refer to a cohort of people in the court system as having a Dublin 1 complexion. And we had a senior minister last year sending out literature to her constituents celebrating the fact that a health facility in her constituency wouldn't be a methadone clinic, because clearly those in recovery are beneath her office, her help. And we criminalise them. We criminalise their addiction. We criminalise their medical need. And we think we can sort the drugs issue in Ireland through criminal sanction. Now, it doesn't work. It hasn't worked. It actually hasn't worked anywhere. The idea of a war on drugs is a colossal middle-class lie, because the war on drugs is a war on people and a certain type of person. So, Minister, I would say this to you, that the issue of decriminalisation of the person has to be at the forefront of your agenda. And whenever somebody in politics or in a lobby group or in public commentary uses the word decriminalisation, people immediately assume something completely different, that we're talking about legalisation of substances, that we're talking about decriminalisation of cannabis. We aren't. We're talking about decriminalisation of the person. Because the opposite of addiction is not being sober. The opposite of addiction is connection. Connection with life, connection with people, connection. Now, we've had a debate here today and yesterday ensuring that we can open up public houses which sell a drug that kills 100 people a year through fatal overdose. 100 people a year die of fatal overdoses of alcohol, 2 a week. And these houses have been used to further the agenda of those who want to distribute that drug. Fair enough. Nobody would ever suggest that the best way to deal with alcoholism, the best way to stop 100 people dying a year, is to stop selling it. But that's exactly what we do. Or to criminalise those who take it. But that's exactly what we do with every other substance, which is a drug. So, Minister, in the few seconds I have left, I want you to prioritise decriminalisation as a national policy. But I also want you to prioritise your stated programme for government commitment to the establishment of a citizens' assembly on drugs. It is a commitment within the programme for government. It's something that can be delivered. It's something that has to happen immediately, because if you're in a situation where you have the third highest overdose rate in Europe and people are literally dying on the streets across the country, then it is something that must take a much higher priority. And if it was to be treated the same way as Brexit, and if it was to be treated the same way as COVID-19, then we'd have, I believe, a much fairer and more decent society that looks at the most vulnerable, doesn't call them names, doesn't dehumanise them, doesn't have cabinet ministers undermining them, and actually has them looking at this Parliament to be filled with people of compassion who want to help support them in their recovery.
Thank you, Deputy Ríordáin. Our next